At the end of this year, millions of Americans could see their health insurance costs skyrocket, not because of rising medical costs alone, but because a key part of the Affordable Care Act, also known as Obamacare, is set to expire. Health policy experts are now warning of a potential death spiral, a chain reaction that could destabilize not just ACA plans, but the entire U.S. healthcare system. So what's happening? Who will be affected? And why does this matter to everyone, even people with employer-sponsored insurance? Let's break it down. The Affordable Care Act provides premium tax credits, often called subsidies, that help people afford health insurance through the ACA marketplace. These subsidies were expanded in 2021 during the COVID-19 pandemic, making insurance cheaper for millions, especially middle-class families who previously didn't qualify for help. The results were dramatic. Record enrollment, lower premiums. More insured Americans than ever before. But those expanded subsidies are now set to expire at the end of 2025, after Congress failed to pass legislation to extend them. A Democratic-led effort to preserve the credits failed in the Senate, and a Republican alternative plan also failed, leaving millions facing steep cost increases starting in 2026. According to an analysis from KFF, formerly known as the Kaiser Family Foundation, the average annual premium for ACA enrollees is expected to more than double, from about $888 this year to roughly $1,904 in 2026. That's not a small adjustment, it's a financial shock. And premiums are only part of the story. Many people will be forced to switch to lower premium plans, with much higher deductibles and out-of-pocket costs. Others may decide they simply can't afford insurance at all. Surveys show how serious the impact could be. KFF found that if subsidies expire, 1/3 of ACA enrollees say they'll downgrade to cheaper plans with higher costs when they get sick. 1/4 say they'd be very likely to become uninsured altogether. That's millions of people. And this matters because health insurance works best when healthy and sick people are in the same pool. When healthy people drop out, the system starts to unravel. Health policy experts call this scenario a death spiral. Here's how it works. Premiums rise sharply. Healthier people leave the insurance pool. Remaining enrollees are sicker and cost more. Insurers raise premiums again. More people drop coverage. Eventually, insurance companies may stop offering plans altogether in certain areas. As Professor Gerard Anderson of Johns Hopkins put it, the sicker people are the only ones that stay in the program until it becomes no longer sustainable. This isn't theoretical. It's happened before in insurance markets. The effects wouldn't stop with ACA enrollees. When more people are uninsured or underinsured, hospitals provide more uncompensated care, medical systems absorb losses, prices go up for everyone. This is especially dangerous for small hospitals, rural hospitals, which already operate on thin margins. Experts warn that some rural hospitals could be forced to close. And when hospitals raise prices to survive, those costs often get passed on to employees with job-based insurance. In other words, even people with employer-sponsored plans could end up paying more. There's a striking political irony here. More than half of ACA enrollees live in districts represented by Republicans, according to KFF. Farmers, ranchers, and rural families are among the most dependent on ACA coverage, especially where employer-based insurance options are limited. Yet many of the lawmakers who voted against extending subsidies represent these very communities. Experts say rural Americans will likely see even larger premium increases than people in cities, because there are fewer insurers and less competition. So far, enrollment numbers haven't dropped, but that doesn't tell the full story. Open enrollment runs through January 15th, and the real test comes when people must pay their first premium. Policy analysts say that's when reality will hit. Who can actually afford coverage? Who drops out and how insurers respond? If Congress does nothing, the U.S. healthcare system could enter 2026 with higher premiums, more uninsured Americans, financial stress on hospitals, and ripple effects across the economy. The expiration of ACA subsidies isn't just a policy change, it's a potential turning point. Experts warn that once a healthcare system enters a death spiral, it's extremely hard and expensive to reverse. The question now isn't whether the impact will be felt, but how widespread it will be and how long it will last.